For Action News, I'm Anna Doloski. The good news in obesity is that recent trends suggest its incidence in Americans seems to be slowing down. The bad news, many Americans are already overweight and obese, and the biggest factor is not calorie intake, but calorie burn-off. The news comes from a recent study in the American Journal of Medicine. Researchers compared data from the National Health and Nutrition Examination surveys, and they assessed BMI and waist circumference. They found a proportion of adult women between 18 and 39 years old who reported no physical activity rose from 19% to an astonishing 52%, and overall 50% of adults reported no physical activity. ACTIA's Dr. Ruth says most alarming is how the trend affects expecting mothers and their offspring.
What this study indicates that over, say, the last 2 decades, it hasn't been calories that have changed, calories in that have changed so much as a decrease, a big decrease in physical activity that's been reported. And what these researchers looked at, these are folks from Stanford Medical School. They actually looked at the NHANES surveys, which are national surveys that are done about every 2 years. And they looked at the surveys done between 1988 and 94, and then again between 2009 and 2010, and they compared the information from those 2 periods. And they found that although the calories that people reported having consumed didn't change over that period, the physical activity levels decreased substantially to really what's sort of an astonishing amount. And waist circumference is an indication of what's called abdominal obesity, that is the fat that is below, sort of around the internal organs. And they found that that increased substantially between those 2 surveys. So this is really of concern because not only were Americans getting fatter, they were getting the type of obesity that is considered to be most deleterious. And in fact, even among people who had a relatively normal BMI, they were still increasing their waist circumference and therefore their abdominal obesity. So that's not good, because that increases your risk of things like diabetes and heart disease. But what I find even more concerning is that the 18 to 39 age group in women, this is the prime childbearing years. And so you're looking at women who may be obese and have a particularly deleterious kind of obesity at the time they're most likely to become pregnant. And obesity during pregnancy can lead to a number of problems, both for mother and fetus, like gestational diabetes, and for the baby, an increased risk of spina bifida and other neural tube defects. So on the one hand, people are not eating anymore, and this is sort of a broad-ranged population level assay. But what they're doing is getting less and less active, and that's a problem. So we need to put more emphasis on that. Perhaps we need to find ways to encourage people to get more exercise, even in situations in which people may live in neighborhoods that they consider unsafe and they don't want to exercise outside. So it becomes a whole socioeconomic kind of issue as to how we're going to encourage people to do this and give them the opportunity to increase their activity levels. So this is something that we need to take seriously and investigate how we're going to deal with it.
To read more on this story and others, you can head to our website, actia.org. And while you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For Action News, I'm Anna Doloski.